WCDB Albany, 90.9 FM. My name is Luke. I am running the board today for the Social Worker Show, and right now I'm going to turn it over to them.
Thanks, Luke. You're listening to the Social Workers Radio Talk Show here at the University at Albany, WCDB FM. I'm Kathryn Zox, your social worker with the microphone, and Luke Stein. And my co-host here is Alyssa Lotmore. Alyssa graduated from the School of Social Welfare a short time ago. She's done a lot since then. She's also part of the... I was going to say part of the faculty here. I'm not sure you're considered. Are you part of the faculty? Yeah. And a mom.
Yes,
I don't know if we mentioned that week. Last week. She's a mom.
Congratulations on that.
Yeah.
Thank you.
Yeah.
A year and counting. So
cool. That's great. Yeah, that's the biggest challenge, right?
Yeah.
Yeah. Well, we have a good show today. We always have a good show. But our guest this morning is going to be, he's a psychologist, not a social worker, but a psychologist, Dr. Guy Winch, and he teaches at NYU. He's a clinical psychologist. He's written 2 books. This is his second book we're going to be discussing with him today. And the title of the book is, what is the title of his book? I've got the wrong sheet here, Alyssa. Yeah.
It's Emotional First Aid, Self-Help for the Wounded Psych. So I don't know if there's a little bit more to it, but I think it talks about practical strategies for treating failure, rejection, guilt, and other everyday psychological injuries.
So he hits on all of them. He has a very unique approach to this whole thing, right? Oh, here it is. We have so many papers here. If you could come in and see the studio, we got stuff all over because we want to be prepared, but maybe I'm over prepared. I have too much. I can't even find the sheet I need. But okay, yes, his Dr. Guy Winch, Practical Strategies for Treating Failure, Rejection, Guilt, and Other Everyday Psychological Injuries. His approach, and I don't want to talk too much about it, but we have a lot of questions to ask him, is unique because what he says is we have all these, we just mentioned some of those things that all of us suffer from every day, some of us more than others. We don't have to identify ourselves, but... so loneliness, rejection, all of those things. And Dr. Winch maintains that we just don't take care of ourselves. We don't do anything about it. We don't maybe necessarily need to go to a therapist, a psychologist, a psychiatrist, or a social worker, but we need to do some kind of self-help, administer a Band-Aid. We've got a medicine chest full of ointments and salves and antibiotics and medication when we have a physical injury, and we don't necessarily run to the doctor or the surgeon or even the general practitioner, but we put a Band-Aid on our finger, we take medication, but we don't do that for our everyday psychological injuries.
Yeah, I mean, it was one thing I remember reading a little bit about him, and he used a great example, which I hopefully won't use again right now, but he was talking about how we take such good care of our teeth. And, we brush them every morning and night.
And I have to say, you take great care of. You got gorgeous teeth.
Thank you.
I'm going to ask you about that after the show. White, beautiful teeth. Yeah.
Thank you. But he's like, we take such good care of those every day. If we have any type of ache or pain, we'll go to the dentist to get it fixed because we don't want it to rot. But how often do we really do self-checks for ourselves and say, okay, I'm a little stressed today, or, something happened last week, it's still bothering me, how do I deal with it? You just sort of trudge on. You don't want to, address that there's some sort of emotional issue when there really is, and it really does affect your physical health, it affects your mental, emotional health, and we just sort of push it aside like it's nothing when it really does need to be addressed.
Yeah, I think that's a good point, and this is something I want to discuss further with Dr. Winch because it impacts on your physical health, and he maintains that certain kinds of losses or certain kinds, guilt or shame or whatever affect your body in different ways. So we want to talk about that. Did you see in the Times-Union today? This was, I think it was this morning, and this kid who had, I guess he had done some marijuana. I don't know if he had done any kind of theft or anything, but he was not doing well in school, and his father, I'm not going to read the name. A 17-year-old kid at Lansingburg High School was misbehaving. And what his father made him do, this is a 17-year-old kid. Tell me what you think about this, because it kind of ties into what we're going to be talking to the doctor about. Made him wear a placard I don't know if you saw this, Luke, but did you? And I want your feedback too, but made him wear a placard, stand on the street, and subject himself to public humiliation, because the placard, I guess, mentioned all the wrongdoings that he had done. And to me, this was shocking and something I don't think is helpful, or is going to be helpful to him, to be publicly humiliated. What do you think?
I mean, there's a few, actually, they made the news around the country of a few other parents doing this. And I think, I mean, I know the parents, when they're interviewed, they're saying, you know, it's teaching my child the lesson. If they're going to do this, and they're going to, you know, let everyone else know, and they're going to have to take a consequence. But it's sort of an emotional consequence. And does that kind of fit is that the right consequence for the behavior, or is it just a way to embarrass a student, or I mean, a child? And
or is it a desperate father who really doesn't know how to handle the situation and needs to take himself and his kid to family therapy or to a social worker?
It's just sort of like, does the child's behavior, the consequence given has to match the behavior. So if they're, you know, it just has to correlate. And I don't think a sign really, embarrassing your child really has that cause and effect, kind of like, okay, you did this, now you're going to wear a sign that tells what you did and embarrass yourself in front of your friends and other people. So it's sort of, I think it can do a lot to the self-esteem of the child as well. I mean, they were acting out maybe because of some sort of self-esteem issue or some type of emotional issue, and now it's sort of you're beating on that and saying, okay, now you're going to embarrass yourself even more and kind of hurt their mental health more, in my opinion. I mean, I don't know.
I think so too. I agree with you. What do you think, Luke?
I have seen or I've heard of this more appropriately at what is known as the therapeutic communities, which is a sort of extreme approach to drug abuse. But like, and you will see that, like, if you go and visit a therapeutic community, people will be wearing signs like saying, it's like, ask me, like, my friend was in one, and he said there was a guy who was wearing a sign when he first got there that said, ask me for a great big bear hug. And it was a way of, like, you know, getting people to go outside of what they were comfortable with and dealing with those sort of situations. But usually, like, you end up at a therapeutic community after lots of other things have not worked. Like, it's not like the first thing that, like, you know, during your first time getting arrested for drugs, they send you to a therapeutic community. Like, that's generally your third time or something like that.
But if you're in a therapeutic community and you're doing it, you're in a different venue. That's a different context.
That is totally
I mean,
true.
you're with people who have similar problems, and you're in the context with therapists and helpers, people who are going to help you professionally. This kid is on the street.
Yeah, no, this does not seem like an appropriate response for this situation
And
at all.
I think with, like, things like YouTube, parents are looking at other ways. Like, I saw something like this similar a few months ago, and it was a younger kid, and he had stole something from a corner store, and the mom made him write, like, if you want to be a thief, I'm going to end up in jail because I steal. And this is like a younger kid holding signs. So I think, like, with the age of YouTube, people are seeing what other parents are doing that might not be appropriate, but just because they're finding it on the computer, they have this idea of, oh, I can do that with my kid, or things. And it's really not always the best way to handle the situation.
Yeah, I mean, I think if you look back, I mean, if you do kind of any in-depth kind of research, I don't think any kind of humiliation is really positive. I mean, humiliation, however you do it, whether you make your kid stand on a corner and talk about everything that he's done or she has done that's inappropriate, or you humiliate them even within a family situation, you know, taking a child or a sibling. And humiliation is really detrimental. I mean, it's, you know, social work 101, really. I mean, that's not something you want to do to a client, to a patient, to a family.
And it's not something you forget. I can remember things that when I was little that stick out, but it was embarrassing to me. It was like, it was made me uncomfortable. It was something that, I remembered it, which I don't know if that's the goal of the parents, is to have them remember how this felt. But it was something that I still remember, and I would never want to subject another person to that type of experience. So I'm not.
Oh, I can, and I'm not going to say them on the air, but I definitely remember probably about that age of having a humiliating experience. And I do remember it. I don't think there was anything positive that came out of it. It was just humiliating. Yeah, you do remember it, but that doesn't necessarily mean that you remember it and it's a good thing and has a good impact. Okay, so as social workers, what would we do in this case? I was just looking into the thing, what the kid said, written on the sign: I like to smoke pot, disrespect my parents, teachers, and school officials. I'm quoting this from the Albany Times Union. I'm a senior in high school and got suspended for being involved in a theft. I'm embarrassing my family, but for the most part hurting myself. That's what was on the sign.
But the thing is, I know from working with middle school and high school students, the fact that a parent even got their child to stand out there makes me think that the child still has some respect and the parents still have authority over them. So was this type of extreme necessary for a child who, I mean, I know some 17 years old, if their parents said to do that, they would just curse them out and
blow them off. Yeah.
So the fact that this kid was even did this, because his parents told him to, makes it say, was there a need for such an extreme when your child still is following your instructions in a way? I mean, they made a mistake, but they're still following your instructions to do this, because I don't know some other 17-year-olds who would actually comply and do that.
Yeah. Would you?
I mean,
would you think you would? I mean,
I would have probably listened to my mother if she had said something like do it, but I don't know if I would. I mean, it would have been a different probably situation thing written on the sign, but I mean, I would have enough.
He would have done other things, not what he did. Yeah.
But I was one of those kids who listened to my mother.
Yeah.
So I'm saying, if he's still listening to his parents to do that, maybe was that extreme necessary to embarrass him in such a way? If the parents still have that authority, couldn't there have been a different type of approach since their child is still listening to them for the most part? So
the parents are degrading him, and that was probably consistent with the way they treat him all the time, and he allows himself, because I find it's degrading.
I mean, yeah.
Yeah. So this isn't usually, and this is part of, when you're seeing a client as a social worker, this is usually the tip of the iceberg. This is not some unique situation in terms of how they treat their child or their kid. This is their operating system. This is what they do. This is, when he does something wrong, I guess humiliation would be part of how they handle his misbehavior.
I mean, when you asked me if I would do it if my mom asked me, yes, but I don't think my mom would ever have asked me to do something like that. So I think the parenting aspect needs to be addressed as well. I mean, now this kid is in the paper and now everyone knows about it, whereas first it was just the people who drove by. Now it's a more than extreme, it's a very public humiliation, because this is going to be lasting for years. I mean, I'm sure you could find his name and with this picture on the computer.
Yeah, that's true. It's kind of like, what is it, Hester Prynne, who had, committed adultery? Who wrote I can't remember. It's one of those required readings.
Scarlet Letter.
The Scarlet Letter. Yeah. She had to wear a big A on her chest, that public humiliation. Yeah. So, I think our guest is calling in, and Luke is going to answer the phone. And after he gets off the phone, you and I will take a break. Yep. And then we'll get back to Dr. Guy Winch.
Very excited. Very excited to
Yeah. All right. So we'll take a short break right now, just a minute or two, and then we'll be back.
Just now, another kid dropped out of school. There's one every 20 seconds. Over 200 kids an hour. That adds up to nearly 5,000 kids every school day.
If we do nothing, 3.5 million kids won't receive a diploma over the next 4 years. But there is someone who can change that. And that someone is you. United Way knows that kids who have a caring adult in their life are more likely to make it. So make a pledge. Tutor a child who needs help. Mentor a kid who needs someone on their side. Volunteer to read to children. Because the path to success or failure starts long before graduation day. And the difference between a graduate and a dropout could be you. Take the pledge to volunteer now at unitedway.org. Brought to you by United Way and the Ad Council.
Should be on.
We're back. I'm Kathryn Zox, your social worker with the microphone. You're listening to the Social Workers Radio Talk Show here at the University at Albany, WCDB 90.9 with Alyssa Lotmore. She's my co-host and a recent graduate, an LMSW, and also works here at the university. And our guest, who is here with us this morning, is Dr. Guy Winch. Dr. Guy Winch is a PhD, a psychologist. He teaches at NYU, New York University, and has a private practice in Manhattan. His first book, The Squeaky Wheel, has been translated into 6 languages, and this new book is that probably will be translated into 6 languages or maybe more. Emotional First Aid, Practical Strategies for Treating Failure, Rejection, Guilt, and Other Everyday Psychological Injuries. We mentioned this before Dr. Winch came on the air, but I'm going to just say it again. You know, we treat our physical injuries, we hurt ourselves, we have Band-Aids and medication in our medicine cabinets to do that, painkillers, whatever we need for our physical injuries, which we sustain every day in everyday life. But what about the psychological injuries? We don't do that. Rejection, fear, loneliness, and I guess we sustain those as often or maybe more often than we do these other physical injuries. So here to talk to us about that and his book is Dr. Guy Winch. Welcome to the show.
Thank you very much for having me.
Great to have you on. It's an interesting concept, I guess one that I had never thought about before, and neither had Alyssa. So we're kind of intrigued with the whole premise of treating our psychological or our emotional, I guess, is there a difference, our psychological injuries?
I guess I use them as slightly interchangeably. I think emotional, why I use psychological is because they usually have an emotional but also a cognitive component, also a behavioral component, and so I wanted to make something that's a little broader than emotional, because some of the injuries are primarily emotional, but they also have other components.
All right, so you have listed the 7 most common injuries, psychological injuries we suffer in daily life. Do we want to go through each one of those? I do want to do that, but before we do that, I wonder, why do we need to do this? I mean, why is it important for us to address these psychological, emotional injuries in everyday life? Why can't we just let them go?
Well, I think most of us do let them go, but I think the error of doing that is that many times they become compounded and they become infected. And, you know, as social workers, as therapists, as mental health professionals, we hear all the time from people that they talk about wounds that they sustained months and years and sometimes decades ago that they never quite got over, that they never quite healed from. And that's what can happen with some of these injuries, because if we're talking about something like rejection or failure, well, that can impact us quite severely in some situations and really cause some kind of wound that we don't get over unless we tend to it, that just stands there and festers, and we can then end up ruminating about it, and then we can end up becoming depressed as a result of that. I mean, there is a chain of reaction that often happens with psychological injuries that starts from a specific incident. And so it's prudent to try and treat it and make sure that, A, that we heal quickly, that we don't experience emotional pain for extended lengths of time if we don't have to, and B, to prevent infection. Just like we would treat a basic cut, the small cut itself is not that dangerous, but if it becomes infected, it can become dangerous.
Dr. Winch, how do we overcome, and I'm going to say we get defensive, I think, sometimes if it's a psychological injury. There's this kind of like we just want to kind of push it away. We are embarrassed by it. We don't want to feel the loneliness or the rejection. So it's different. It's easier to treat a physical injury, you know, you cut your finger, you have a fever, because there's no stigma attached to it. There's a stigma attached to some, feeling lonely, isolated, rejected.
That's absolutely true. And so there are two components to what you're saying. Number one, there is a stigma attached to it. And so in part in the book, I talk about in each chapter, each chapter is devoted to a specific injury. And in the first part of the chapters, I really discuss what is normative, what the science tells us about what happens to everyone in those circumstances. Because in part, the stigma associated with any kind of mental health issue is a result of ignorance, is a result of people not understanding what's involved, what happens, how these things can happen. For example, rejection causes sharp pain, even small rejections, to almost everyone. And so we don't know that, and we'll think there's something wrong with us, that such a small incident, that our friend didn't like our vacation post on Facebook, and we can feel rejected and insulted and feel like, well, what's wrong with me that I'm stewing about that for 3 days in a row? But unless we understand what's happening in our brain and the fact that that's a very normative response, we will feel that there's a stigma attached to it. So that's the first thing. I agree. Stigmas are usually a result of lack of knowledge and really ignorance in some cases. But the second thing is, it's easier for us to treat the cut because we automatically know what to do. And when it comes with the psychological injuries, we actually don't know what to do. So it's not just the stigma. It's also, well, even if we wanted to treat it, what exactly do we do? In what ways are we injured? How do we treat each of those injuries? And so those two together are the things I think you identified correctly that really prevent us from taking the kinds of steps we really should.
All right, so give us some examples in the book, because I think that having something, a specific example, you talk about rejection, and you gave the example of feeling rejected because somebody didn't like your vacation plans. Also, if one feels that way, what does that say about them in terms of their feelings of self-esteem? Isn't there kind of a, if you feel rejected because somebody doesn't want to go out with you and you've been dating them for 3 months, isn't that different than like being rejected or feeling rejected because someone disapproves of your trip to Mexico?
So, look, I mean, it's a good question. But so for example, in the book, I talk about how we study rejection, because I do want to make the point really clearly about how we're wired. And so the way we study rejection is that there's this experiment. I'm just going to say, very, very quickly what it is, because I think it's very, very illustrative. The way the experiment works is you have somebody come in for some kind of social psychology experiment. There's always another reason, supposedly, that they're coming in. They're sitting in a waiting room, and there are two strangers in the waiting room with them. And one of them sees a ball on the table and picks it up and tosses it to the other, who tosses it then to the person who's there for the experiment, who tosses it back to the first person. But then the two people start tossing it among themselves and exclude the person there for the experiment from the ball tossing. So this mild thing in which you were sitting in a waiting room with two other people who were waiting for something, and they started tossing a ball, and at first they included you for a round or two, and then they excluded you. And you don't know these people, you don't know anything about them, you have no attachment to them, and after a few rounds of that, you're called into your experiment. In terms of rejection, it's pretty much as mild as it gets. It's not somebody you've dated, it's not somebody you have any emotional investment in or interest in, it's not somebody you know anything about. But what people find when they do these experiments, and they've been done many, many, many dozens of times, is that exclusion, that little incident of rejection, causes sharp emotional pain in people. It causes their self-esteem to drop. It causes their mood to drop. It causes surges in anger and in aggression, and it makes them really start questioning, their self-esteem and their attributes and their likability. And the other thing is, when they do these kinds of experiments and they put people through functional MRI scans where they can see what happens in their brains, they see that the same area of the brain lights up when people go through that experience as lights up when people experience physical pain, which is why the rejections hurt so much. So if you know that, and if you know that being excluded from a stupid ball-tossing round in a waiting room by two strangers can cause people sharp emotional pain that is the same that they would experience during physical pain, then yes, you can start to imagine that if your date doesn't call you back, or if you've always liked your friends' vacation pictures on Facebook, but they're not liking any of yours, and these are people you actually do care about, then yeah, maybe there's a reason you feel, the pain that you do, because we're wired that way, and you don't have to have good or bad self-esteem. I mean, it does make some difference, but anyone can feel the pain of rejection because we're wired so strongly to experience it.
So if we're hardwired for that, obviously, psychologically, we are hardwired for that kind of a reaction to that, kind of rejection, what do we do about it?
I'm going to say that in just a moment, but I do want to say that when I explain this to people, even in my own private practice, who talk about sometimes mild rejections, they do feel a huge measure of relief, because it does take away what's wrong with me that it hurts so much question that we all have, and that can then lead to all kinds of, self-blaming and self-bashing. So knowing that we're hardwired that way, I think, is an important thing within itself. So what we do about it is also a little tricky, because it impacts us in all those different ways that I mentioned. There's the emotional pain that we experience. There's a blow to the self-esteem that we experience. There's the surge of anger and aggression that we experience. And it also tampers with our fundamental need to belong. We have this fundamental need to feel as if we're a part of a tribe, a family, and it kind of tampers with this unsettling feeling of, well, where do we belong? Are we disliked, in some kind of broader way? And each of those 4 injuries needs to be addressed. And so when I talk about the treatments in the book, I lay out treatments and explain which of those treatments will address each of those 4 injuries, so we can do a full 4-quadrant targeting of this wound. But I'm just going to give one example. And one example I talk about in the book is that it's very, very important to argue with self-criticism, because that, with the hurt to the self-esteem is 10% the incident and 90% the overlay of self-blame and self-criticalness and internal negative dialogue that occurs in the aftermath. And so if we can at least switch off that 90% that we're going to add on and not kick ourselves when we're already feeling down, that would be a very important thing, to stop the bleeding. Because again, rejections, when the date doesn't call you back, or when they dump you after a few dates, most people will go through this litany of why I'm not good enough, and why I'm not this enough, and here's what's wrong with me, and here what I did wrong, and why am I such a loser, and why does this keep happening? And to stop the bleeding, to stop really making ourselves feel worse when we're down, is an important step. And so I provide a lot of ways to counter arguments and things that you need to ways to think about things that will help you stop the self-blaming and the self-bashing and the negative self-talk that happens in the aftermath of these kinds of events. I quote the Seinfeld line that says, in Seinfeld they said, I know it's been a while since Seinfeld's been on, but the line of, it's not you, it's me. And so I say, if they're telling you it's not you, it's them, yes, then believe it's them. And if they're not saying that, then assume it's them anyway, because it is most likely them. If you've been dating somebody, for a while and they have no real clear reason to drop you, then it's a matter of match. It's a matter of you didn't, fit in some kind of way with what they were looking for, and that's not necessarily a personal thing. It could be they prefer blondes and you weren't a blonde, or they prefer men with curly hair and you have a bald head, or whatever it is, that it's some incompatibility, and it's no one's fault, an incompatibility. So looking for fault is not a wise thing to do.
Let's talk about failure, because I think that, we're on a university campus, we're social workers. We often deal, in a clinical situation with people who feel that they failed, and the impact of that, and how do we handle that failure, whether it's failing a test, getting an F, or you didn't get into graduate school. There are lots of things that we can talk about or describe that happen here on campus.
Yes, so midterms are around the corner, and one of the things that again, when I talk about failure in the book, as in the other chapters, I really talk about some of the experiments that illustrate what actually happens to us, and by us I mean all of us, when we fail. There was one really great study that I talk about, in which people were asked to kick a football over a goalpost 10 times, and then they asked them, it was an unmarked field, and then after they completed the task, they said, estimate how far away and how high the goalpost is. And the people that failed at the task estimated the goalpost as being much further away and much higher than the people who succeeded. And there's a metaphor there, because that's what happened when we fail. When we fail, we tend to then look at the same goal we were looking at and see it as being further away and further out of reach. And we also tend to look at our same abilities that hadn't changed and evaluate them as being less up to the task. And in essence, the goalposts hadn't changed and our abilities hadn't changed. So those are both two distortions, the cognitive distortions, that can really impact us. So if somebody, if a freshman at college fails its first midterm or her first midterm, they might conclude from that this course is too difficult for me, maybe even college is too difficult for me. But in fact, the course is not too difficult necessarily. You actually have to look back and see what variables were in your control and which one of them do you have to tweak. It's really just about figuring out what your approach was that didn't work and figuring out how to make it work in the future. And so there shouldn't be any value judgment or any self-esteem or ego, even though that's very hard to do. There shouldn't really be any conclusion about your ego and your general worth or general intelligence. It should really be about your effort, your preparation, your planning, how well you studied, what kinds of distractions were there for you, how did you succumb to them, how can you make sure you don't succumb to them next time. So you really, when dealing with failure, it's really about the post-mortem. It's really about figuring out in what ways did I go wrong that are in my control, that I can change and make sure don't happen the next time. And that approach takes it out of the realm of whether you're okay, you're not okay, you're smart enough, you're not smart enough, because really, truly, any student that gets into a college should be able to succeed at it. There's no reason other than their strategies, their approach, their efforts, distractions, etc., that would prevent them from doing that.
So the student in this case needs to look at it or approach it as a problem solver. This is a problem to solve. As you say, they got into school, they were accepted, they should be able to do the program. So let's take a look at it in terms of problem solving and not looking at it in terms of I'm not good enough or I shouldn't be here. Taking it back, what can parents do to prepare their students, let's say, to be able to take that kind of approach? And maybe not just when they're in high school, maybe we can even take it back. What do we do with our kids when they're in elementary school so we don't get to the point where we're not addressing all of these, psychological injuries later on in the right way?
Well, that's such a wonderful question, really, because I believe that all the strategies I'm suggesting in this book, literally almost every single one of them, are ones that we can and probably should teach to our children, because they're strategies for coping with life. As you said, failure can happen. Failure happens when we're born and we start experimenting with trial and error and how to stand and how to walk and how to put this into that. So failure is something that, it really accompanies us throughout life. And parents really can use these strategies to teach their children how to deal with these kinds of things. If your kid is in high school, or even if your college kid is calling and saying, oh, I didn't do well in the midterms, rather than go, oh, well, did you party? What were you doing? Rather than do that, why don't you just say, oh, well, you know what, let's talk about your preparation and let's talk about what you can tweak in terms of your approaches. Because what happens with college students specifically is that they tend to bring to college the same strategies for learning that they had in high school. And they're not in the same environment because all the stakes have just gone up. The relative difficulty has gone up, and the relative the quality of the people around them has gone up. So maybe those strategies will work, and maybe they'll succeed. But if those strategies don't work, they need to understand that, okay, what worked in high school is not going to work or work well enough in college. How do I change my learning strategies? What do I need to start doing differently in college that I didn't need to do differently in high school? So it's back to, as parents, help your kid problem solve what they need to do differently. Help them really be honest about where they could have had better preparation, better effort, started longer, started ahead of time, read the chapter before they went to class so that it's, that they're hearing the information for the second time rather than the first, etc., etc. And when your kids are at home and when they're still, in school and at home and even before, then help them approach failure as failure. All failure is a way to get hints about what you need to change to do better in the future. That's all it is. It's not a statement about you. It's a statement about what you need to do differently. It's not a personal thing.
And when you talk to people or you read biographies or autobiographies of people who are really successful, I think one of the things usually that they say, or very often, is that their failures is what propelled them to become so successful, being able to take those failures and turn them into successes, which is, in your book you talk about how to actually do that and strategize and be able to do that. That the failures were almost more helpful than for learning purposes and for accomplishing their goals, whatever they are, rather than the successes.
Absolutely. That's absolutely true. And sometimes, once in a while in my private practice, I'll get somebody who's really had this kind of charmed life that, they really didn't have many big failures and they're just used to succeeding. And then failure hits them in a big way for the first time when they're in their 30s or 40s or 50s or 60s, and they don't know what to do with it because it's an animal they're not familiar with. They've just never had to deal, always it just worked, and so now it doesn't, and they don't have strategies. They haven't developed a way of looking and examining and tweaking, and so it's actually a great skill set I'm not selling failure as, oh yeah, go out and fail, because that's terrific. But it is a great way to develop a skill set that's kind of important. And so I would really see it as such. Failure is a great teacher. It's trite, but it's true if you know how to deduce the right lessons from it. So go learn that, and it'll serve you very well in life.
But let's talk about loss now, because all of us, I don't think you can live on this planet without having suffered some kind of a loss, whatever it is. So, and that's one of the psychological injuries that you address in the book. So let's discuss loss. How do we handle loss in a positive way?
Well, one of the things about loss that really struck me when I was trying to do the research for the book and really look at what the current studies and the current wisdom is, because, in our field, we're an evolving field, and so, last time I was in graduate school was 25 years ago. Things have changed, so I wanted to really get very current, and I tend to be current, but I wanted to really get updated. And one of the findings that we have, I think that's very, very powerful for people about loss, is that we really need to process things our way. And I mean specifically that some people, when they experience a loss, and the loss can be, you've lost somebody to illness or to death, or that a close person has moved away, or your pet died, or your kids actually went to college and now you have an empty nest, or you retired and now you have this big, hole in kind of your existential life, whatever the loss is. But some people really feel the need to talk about it, to process it, to share it, to really talk as much as possible. And some people don't. Some people, even in the wake of significant loss and significant trauma, would rather not sit and talk about it. They'd rather just go on. And our typical wisdom is, well, then no, that's not a good thing. They have to get it out. They have to get it out. But for those people, again, specifically for those people whose natural inclination it is to not want to talk about it, to not go through the traumatic event, to just move on, it's actually very important they be allowed to do so, because they tend to do much, much better when they're allowed to follow their natural inclination. And unfortunately, all the well-meaning people around them, and a lot of therapists often, in that case as well, will feel like, no, you have to talk about it, it'll fester, it won't be good for you. But for them, they have the kind of coping and defense mechanisms that allow them to compartmentalize in a successful way, and to really put it aside and to refocus back on life. And for them, getting into it when that's not their want will actually traumatize them more. It'll delay their recovery much further, and it'll actually create wounds that don't have to be created. And so we really have to follow our own inclination, and we really have to allow people to do that, and understand that if somebody says, I don't want to talk about it, they're not being they're not being difficult, they're not making a mistake, they're doing what they think is best for them. Now, when it's children or when it's younger people, or even with older people, I would always make clear, if you're around these people, that if at any point you do, even if it's just to share your feelings, even if a little bit, let me know and I'll be there for that. In other words, to give them the option to do that if and when they're inclined to, but to allow them to process things in their own way when they feel the need.
Well, I think that's such an important point, and I think I've done a lot of hospital social work, and particularly with seniors and the elderly, who are always suffering, women and men in their 70s and 80s and even 90s, and they are constantly, even daily, suffering loss. I mean, loss of cognitive skills, or, their bodies they feel more vulnerable, their friends die, all of those things. And I think that it's so important, especially as social workers or as clinicians, that, the tendency is to, well, let's talk about it, and they don't want to talk about it because they're in a constant state sometimes of loss, and they are able to compartmentalize and talk about the good things and not to force them. And I think especially with the aging population whom we are dealing with, that's kind of key, I think, and critical, and something that, we tend not to do as therapists. You got to get it all out. You have to, it's important. Otherwise it's going to say stuffed in there and it's going to affect you, and it's not a good thing. But it's really important, I think, not to do that with the aging population.
You're right, because, I mean, for them, the losses are, pretty much daily, whether it's certain functions, friends, whatever it is. And so they could spend their whole time just talking about the loss and how terrible this is and how sad that is. And that will define their existence in a very, very negative way. So, yes, let's just move on. Let's just, I think that's completely right with somebody who's in a population like that or a person like that who's, is facing really a series and multiple losses. It's even more important to really meet them where they're at emotionally.
Yeah. I mean, I've been frustrated with my own mother, who's very, very elderly and suffering loss every day. Friends die and they're sick, and I've kind of wanted to, well, let's talk about it. And she doesn't. That's not what she wants to focus on. And so, I've sort of experienced that, or have experienced that personally, and I think you're absolutely right. So, all right, next, we'll talk about guilt. How does guilt fit into all of this?
Well, guilt is an interesting thing because it's like a lot of these psychological concepts that we have, that in small doses is terrific and in large doses is not. Because what guilt does is it alerts us when we are about to do or we've done something that is going to harm another person around us. And so it's a signal in our head of, uh-oh, or watch out, or you need to fix something here. And so in small doses, guilt is really great for preserving and maintaining our relationships because it gives us the signal. We respond to it and take appropriate action. The guilt goes away, and there our relationship is saved, preserved, maintained, what have you. But when the guilt is excessive, when it's unrelenting, when the incidents remain unresolved and the guilt really nags at us, then it's a very bad thing because guilt is incredibly distracting. It's like the signal that goes off in our brain, and there is no snooze alarm there. There's no way to shut it off. It's just constantly sitting on our shoulders. It's weighing us down. I mean, there are actually studies to show, this is quite remarkable, but there are studies to show that we feel heavier literally when we feel guilty, that, participants in the study were made to feel guilty and then estimated their weight as being higher. In other words, it literally weighs us down in the most, concrete sense of the word, which is remarkable, these findings, but this is actually true. So the important thing with guilt is that guilt in itself, not a problem. Unresolved guilt, excessive guilt, is a problem, and then we need to know how to resolve it. And when looking at that, one of the most common things, I mean, it seems really simplistic and almost silly, but one of the most common things that happens is that in the situation, we've rendered an apology, and the other person has said, okay, fine, but in essence, our apology wasn't effective because the forgiveness we received wasn't really authentic. There's still a tension there. There's still unspoken issues there with that person, the family member, the friend, whatever it is. So they're still holding something. We're picking it up, and we're still feeling bad about it. And when you go and look at what happens there, it turns out that we are absolutely terrible at issuing apologies. Pretty much a 5-year-old can come up and say, I'm sorry, and we're supposed to say, okay, if they said I'm sorry, that should be all right. But we're kind of stuck at the 5-year-old level. We come up with a I'm sorry, maybe with slightly less attitude, but a very kind of begrudging sorry. The person feels, well, if they said sorry, they have to go okay, but the apology wasn't authentic. And the ingredient that we miss most commonly in these apologies is an empathy statement. And it's the most important ingredient. In other words, it's not sufficient to say, I'm sorry to someone. You actually have to convey that you understand, that you empathize, that you get how your actions impacted them. So if you missed their birthday party, saying, oh, I'm sorry I didn't make it to your party, is not sufficient. You have to say, I'm really sorry I haven't made it to your party. I know we're really close. I'm sure you were troubled during your party about where I was. I'm sure some people were asking you and it was awkward for you. I know how much plan and effort you put into that party, and if in any way I took away from your enjoyment, I really am so sorry. That was not my intention. I really should have called and let you know what was going on, but I just blah, 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 blah. In other words, you have to really convey to the other person, you get the impact of your actions on them. And usually, as the recipients of that, when we feel the other person really gets what they did wrong and is really owning it, taking responsibility for it, and apologizing for something very accurate rather than the blanket apology, it's much easier. We feel so much more relieved because, oh, well, they get it, they understand. And then the forgiveness we give tends to be authentic, and that is the thing that usually will dissolve the unresolved guilt.
I'm thinking about our politicians who are, and usually they're the men, apologizing in public to their wives for having an affair, and people in, presidents and I'm saying politicians right now, our politicians. How does that fit into that? Because it seems to me that's happening all the time, and that's all they say. I'm sorry, and it's like, you're sorry, and it's not only just having to do with their individual relationship, but this is to the world.
Right, and look, I mean, in those situations, I'm assuming that most of what they're saying is scripted by PR people rather than by them. That's the public I'm sorry. But truly, even the public I'm sorry needs to have ingredients in it which they typically miss. And that's why when we look at how politicians apologize, we often feel very, very little sympathy for them, and we tend to feel in our head some version of, oh, they so don't get it. Because even in that apology, we can see they're not really getting what they did. They're just apologizing for this moment of bad judgment or whatever it is that they're saying, but they're not really. I mean, the apology for something like that, certainly if it's for an affair with a wife, has to include, as a politician, I need to spend a lot of time thinking about why I felt entitled to do these actions, what it is that allowed me to do that, and what motivated me, what allowed me to keep doing it. And I need to do a very clear examination of what was going on in my head and what's going on in my life, because there are some essential things in my thinking I obviously need to correct. That would be a little bit more, compelling. And I'm not saying they need to say that to the public, perhaps a little bit, but the one to their wife should be certainly even bigger than that. You have to explain how exactly that was okay with you, not just how it happened, but how you allowed yourself, how you justified it, how you're going to prevent it from happening in the future, and a whole line of things like that. So yeah, there are apologies of the politicians, and not just the one about affairs, the one that misspeak, quote unquote, about a variety of things and then try to correct it, are usually woefully lacking, because again, this general understanding and knowledge of what real effective apologies have to contain is a science that most people don't have. And in the book, I lay out 6 very clear ingredients for what apologies have to contain. And I give a lot of examples of ones that didn't, and how they had to fix them to make sure that they do.
Well, give us a couple examples from the book.
Well, in one, there was indeed a woman who had an affair, and she kept apologizing for, I'm sorry that I had an affair, I'm sorry that I hurt your feelings, but she wasn't acknowledging to her husband that, for example, but now each time that I'm going to be 5 minutes late, what's going to cross your mind is, well, where is she? What's going on? And now each time that this small thing happens, or each time I look at my phone, you're going to wonder, is that a text from someone? What's going on? So what I did is I actually made it really a daily occurrence for you that's going to be going through your mind. And each time you watch television or see a movie in which an affair is a plot point, which is really all over the place, then you're going to have a bad feeling and you're going to feel demoralized. And it's going to take you a very long time to trust me. And I'm going to have to prove over that significant amount of time that I am worthy of that trust. And I'm going to have to show you in what ways what things I have thought about, and what steps I've taken to make sure this kind of thing doesn't happen again. And, etc. There's a lot one has to say to convey to the other person that you really get the implications, that we took vows and I betrayed those vows, and so I broke, your trust in so many different levels, and etc. etc. There's a lot of implications, and you really have to spell out all of them. The other person really wants to understand that in that nuance of, yes, indeed, every time they're 5 minutes late, that thought is going to occur. And every time they look at their phone and have a reaction, and you say, well, what is that? And, oh, no, it doesn't matter. You can't say, oh, no, it doesn't matter. They're going to think, oh, are you texting with someone now? Do you know what I mean? You have to acknowledge the level of breaking trust and the level of mistrust that you've just invited into that relationship, and what it's going to require on your part to mend it, and the amount of time it's going to take.
Alyssa wants to ask you a question, because I've been the one here sitting here doing the questioning, but she had a question that she wanted to ask you because we only have a couple more minutes. So,
Many people feel maybe more comfortable doing the self-help methods, but they don't want to talk to a professional. They don't want to tell somebody else their problems or what's bothering them. And your book is so descriptive that I'm sure a lot of people can benefit from that self-help. But when is it not enough? When does somebody need to say, okay, maybe this self-help book isn't enough. Maybe I need to go see you at your private practice. What is that area that lets you know that, okay, this isn't working. I need to go to actually speak to someone?
Well, that's a very, very good question. In fact, I end every single chapter in the book where the last section in every chapter is when to consult a mental health professional. And I really give guidelines to, okay, so you try these things, but if this happens or if that happens, if you're feeling this or if you're feeling that, then it's time to see a mental health professional. But certainly, just as a general guideline, if you're dealing with these things in the self-help way, and if you're using my book or you're using really any other book to do that, and it's not getting better, and it's not working, and you're still feeling very bad, and you're still ruminating, and you're not able to stop, and you're still flooded with guilt, and you can't get over it. And, whatever the thing is, if it's not working, that might be the time to see a mental health professional. And the same is true really with physical first aid. You'll bandage your own cut or you'll put ice on the sprain, but if the cut isn't getting better or starts to get infected, or if you're still limping 10 days later and it hasn't gotten better, if you're coughing for a week even though you've been resting and drinking warm fluids, but the cough is persisting, usually that's the time you want to go see the doctor. And it's a very similar guideline. In other words, try these things yourself first, because in a lot of the cases they will be sufficient. But if they're not, or if you're feeling much worse, or if you feel you can't complete these things because even that is too difficult for you, that would be the time to see a mental health professional.
Thank you. That's a very great summary of it.
Yeah. Well, I mean, we have to say goodbye, but it's been a great, more than our half hour that we had. Guy Winch, PhD, and we've been discussing his book, Emotional First Aid, Practical Strategies for Treating Failure, Rejection, Guilt, and Other Everyday Psychological Injuries. I think we've kind of scratched the surface. So, Dr. Winch, if people can go to your website, guywinch.com, I assume, for more information about both your books and you. And we'd love to have you back on the show again. This was great.
I would love to come again. This has been a great conversation. Thank you so very much for having me.
Thank you. Yeah, that was terrific.
He was phenomenal.
Yeah.
That was a great show.
Well, we have like a few more minutes, and I always like to have kind of like a wrap up. That was like a therapy session.
It was. He was.
For me, it was.
He was so descriptive, and he discussed it in a way that anyone could really relate to. It was such just a casual type of conversation, but it gave so much deep knowledge.
One of the things he said, and I think, when we're talking about it at the end, I asked him the question about politicians and apologizing, and people really don't spend time, that whole empathy part of it. All of this requires some self-awareness and take a minute. Yeah. And I think, and unfortunately, I think our culture, our attitudes right now are we just want to do it. Whatever we do, whether it's an apology, whether we want to get over feeling rejected, we want to do everything in a couple minutes and then go on to next. Yeah. And we don't want to, there's not a lot of introspection. And I think we didn't mention that word, but there has to be some.
And I loved how he talked about the empathy piece, especially with the apologies. But so much, I think, in society, we focus on sort of ourselves. We think about other people, but we don't really take the time to really think of how it really affected them. We're like he always said, we're sorry I missed your party, but I'm sorry for all the other things, the emotions that you felt. You were worried, you were embarrassed that maybe I didn't come. We don't really apologize and really take the time to think, wow, that person was really affected by my actions. So, I mean, I really think that his book just goes so deep into all of the areas that require psychological first, emotional first aid.
Well, now you're sitting here with your daughter. I mean, just starting out, kind of a tabula rasa, or whatever you want to describe it as. So you have the opportunity to kind of take these tools and apply them. As he said, you do want to start when they're from the very beginning.
You do, because I mean, there's so much. I think our society, we sort of build ourselves and create it's just sort of a normal to hide these things, to not address them. It's looked at as like, like you said, with a stigma, like, oh, you need to go talk to someone, you need to, or you need to read some of these books. Why can't you just handle it and move on? And there's so much focus on, oh, just move on, brush it off. And when people are having issues, they are upset about things, and we kind of just expect them to, like, take a pill or to just deal with it. And no one really takes the time to, hey, let's process it, or let's change our whole mindset. So I think it's great that with my daughter, I can start to sort of break that normal, quote unquote normal way to handle emotions, because they do affect every part of our life and our physical health as well.
You just said something like moving on is not doesn't have to be synonymous with brushing it off. You can move on. You are moving on, but in the process of moving on, it's how you move on. And how you move on is to examine these relationships, the connections, whatever it is, and then to learn from it and take it seriously and not brush. Well, we've got the whole list here: failure, rumination, guilt, loss, loneliness, rejection, and low self-esteem.
And there's so many, like, reading these, there's so many areas that we deal with every single day, and we experience every single day, but we're not necessarily dealing with them every single day. So his book just really encompasses pretty much everything that we're dealing with in our whole life, and how to address it.
Which one affects you the most? I know which one affects me the most, or which two I can, but you don't have to say it. Luke, you can also, if you want to, if you look at this list, or you've heard what the list is. I think the most difficult thing for me, loneliness is not a difficult thing. I mean, I don't usually struggle with that one. Failure and rejection.
Yeah, that's the ones I was looking at too.
And when he was talking about that example, and that's really true, sitting in the office, and bouncing the ball back and forth, and then they leave you out, and but people you don't even care about. How many times have you been in a similar situation? You're thinking, why do I even care about this? But I do feel rejected, like they don't want to sit. I have been to a luncheon, and luncheons, professional luncheons, sit down at one of those big round tables, and thinking, is anybody going to sit with me? Or they all seem to be like gravitating toward another table, and I feel rejected.
Yeah, and it's, even with the age of social media and Facebook, even if somebody, like I said, if somebody doesn't like your picture, it's sort of like, oh, is something wrong with me? You start to question yourself and self-doubt when you're not included, and other people don't even realize that, maybe they were away and they just didn't look at their Facebook page. But we take so much personally and start to wonder about ourselves and self-doubt and say, oh, did I do something wrong? Is that person mad at me? Or so much goes on in your mind, when really it's just, sometimes you just have to step back and have that self-confidence and have that feelings that you're doing everything okay, and it's not you, it really is them, or it's really nothing going on. You really have to take that time to process and not just always jump to something's wrong, or I'm doing something wrong, or I'm a failure, or that rejection piece. You can't always take it personally.
Yeah. You have to not take it personally. Well, my example of going to like a meeting and maybe sitting there by myself because I came to the meeting by myself, and maybe very often the other group of people, if I really analyze it, came from the same office, and they decided they were going to sit together for lunch, and this was an opportunity to be together. They don't know me. Why would they want to sit with me anyway? I mean, so there's a whole other story over there. It's not just about me. We have a couple minutes left. Okay, Lou's gonna,
I was gonna weigh in with the two that I feel the most, I think, are rejection and low self-esteem, but they are things that I've done a lot of self-work on, and also work in therapy on, because definitely those have been the largest ones for me, but those are definitely the ones that I've worked on the most. So like, they're definitely the ones I see, but like, I really try to work on them a lot, so I don't see them as much currently. But
so you are working, which is his whole point, Dr. Winch.
I constantly work on myself. I try to see it, like, I'm currently in between therapists, but I work on these things with a therapist. I work on them by myself all the time. I really think about how I can be the best me that I can be. Like, that is, when I start with a new therapist, they're like, what's your goal for therapy? I'm like, to be the best me that I can be, and whatever that means in the day. So
And I think it's more of a lifestyle. This type of mindset. It's a lifestyle change. It's just you don't all of a sudden just be like, okay, I'm going to, have self-esteem today. You need to incorporate in your life, and every day have those little reminders or little things that you do for yourself that help you to keep moving forward and to make this mindset a part of your life.
Absolutely. It's not a one-shot deal. It's a lifestyle change. It's incorporating into your relationships with your kids, with your family, with work, all of those things. Well, we're going to say goodbye. This was great today. I'm Kathryn Zox, your social worker with a microphone. You've been listening to the Social Workers Radio Talk Show with Alyssa Lotmore and Luke Stein. And did I say WCDB FM?
It's WCDB Albany.
Albany.
Yes.
Have a great week, and we'll see you next Thursday.
Yes. And hopefully, all right, here we go.
Just now, another kid dropped out of school. There's one every 20 seconds. Over 200 kids an hour. That adds up to nearly 5,000 kids every school day.
If we do nothing, 3.5 million kids won't receive a diploma over the next 4 years. But there is someone who can change that. And that someone is you. United Way knows that kids who have a caring adult in their life are more likely to make it. So make a pledge. Tutor a child who needs help. Mentor a kid who needs someone on their side. Volunteer to read to children. Because the path to success or failure starts long before graduation day. And the difference between a graduate and a dropout could be you. Take the pledge.